The exodus of healthcare professionals in search for greener pastures has increased to 50% annually, a situation the Ghana Medical Association described as detrimental to healthcare delivery and will affect Ghana's ability to achieve universal healthcare coverage target by 2030. President of GMA, Dr. Frank Sribo, says the situation is now worrying as the country is losing experienced specialists to brain drain.
Brain drain in the health sector is no brainer. We are losing our nurses, we are losing our doctors, and in the past we used to lose quite young people who probably have just started work and so forth. Now we are losing even specialists. They are leaving. Consultants are leaving. Nurses, well-trained nurses that you don't expect to leave are leaving.
The main reason for these doctors fleeing the country, he says, is financial.
But the issues are clear. Whether we like it or not, the number one driver of brain drain is actually economics. So if we don't do anything about our economic situation in this country, and we don't check how this country is progressing in terms of our depreciation of our cedi, our unemployment status, the kind of things that are happening regarding the economy, we would have to suffer.
President of the Ghana Registered Nurses and Midwives Association, Perpetual Euphoria Manfo, charged government to issue clearance for employment of personnel to fill the gap created by health workers' exodus.
The staffing gaps that have been caused by the immigration of our colleagues is a threat to the safety of our patients and our own safety as health practitioners. We have recently seen the announcement of the Ministry of Health, for example, in terms of the financial clearance to employ nurses. We are excited and we are happy about it, but of course, it will still not mitigate the employment needs of the nurses and midwives within the health sector. And as much as many of them have left, they've caused serious gaps within the health system. And we are aware of the dwindling or reducing nurse-patient ratios and the fact that the workload on those at post is also increasing.
On his part, President of the Society of Private Medical Practitioners, Dr. Andre Kwesi Kuma, wants government to create an enabling environment for private healthcare providers to thrive.
The private sector can go a long way to help retain healthcare workers if the business environment is friendly and conducive. In this regard, we call again on our government to introduce and implement business-friendly policies such as import waivers on medical equipment, lower taxes, special utility rates, human resource support, etc. This will enhance expansion and enable the private sector to retain healthcare workers as well as reaching out more to the districts and sub-districts.
The annual general meeting of the Society of Private Medical and Dental Practitioners is on the theme, Health Sector Brain Drain to Brain Gain, the role of private practitioners. The event brought together players in the health sector to deliberate on solutions to the brain drain in the sector. Prince Kwame Kuduga's report for Joy News.